the next session is the Global Voices. Just hang on a second. Okay, so it's Global Voices, Proven Impact, Advocacy, Best Practices from around the world. And this energising session spotlights 3 powerful advocacy strategies from different regions in the world, from grassroots mobilization to system-level change. Our speakers will share how their work delivers measurable results and how we can adapt these ideas to our own contexts. So I would like to welcome our 3 speakers, Jenny Zhang from China. She leads brand communication and international cooperation, if you want to come up to the stage, for House 86, China's national lymphoma organization, which now supports over 150,000 users. She brings global perspective and lived experience. I'd also like to welcome Ismail Mwaruka. She's from Tanzania. She's founder of the Blood Cancer Foundation of Tanzania. Or he, I'm sorry, Ismail, sorry, I know, sorry. Which has raised awareness of lymphoma and blood cancers across the country and built strong community events. And also my good friend Pasusant Wattanaboony, I hope I pronounced your name right, from Thailand. I call him, he calls me Mr. Ireland, I call him Mr. Thailand. So he's an advocate from CLL Thailand, representing the patient voice in Asia and advancing equitable access to diagnosis and treatment. And I probably should have moved. What I'm going to do is I'm going to move the seats out, maybe put you center again.
I have a slide presentation.
You have slides? Oh, okay. So
Yeah.
have you all slides?
Yeah.
3 slides. Okay. Sorry.
Stand here?
Okay. So I'll let you start. You come on. I should have asked you, sorry.
Good afternoon, everyone. I'm Jenny from China, Beijing, and I represented China Lymphoma and CLL Patient Group. Our group's name, you can see, is House 86. Actually, from my home to Krakow needs 12 hours flight trip, and there's also 6 hours time difference. It's my first time to join this CLL Horizons in person, and to some extent, yes, I noticed that there is so many difference between many of us, and many of us are very unique, and also the difference are not just 6 hours time, and also culture, social background, and how our organizations develop. Some organizations I noticed build like constructing a building with a roof and solid pillars, steering for perfection in every aspect. Our group grows more like planting a tree, broke through the ground and with time opportunities and our own resilience, gradually put down roots, sprouted, grew taller, and branch out from one main trunk, growing leaves so we can provide shelter for lymphoma and CLL patients. Since most of our team are people who are living with lymphoma, CLL, or other diseases, like myself, I was a caregiver of a mantle cell lymphoma. Our common saying is, because we have been through the storm, we want to hold an umbrella for other patient peers. Of course, there's not only difference, I also noticed that we share some common value, like all of our patient groups will keep going, focus on positive, and we believe in the power of collaboration. This reflected in the title of our poster. Next, I will detail the value of collaboration for our patient group in China. And actually this poster I'm going to introduce was primarily created by my colleague Yun. I also only provided limited assistance and some manual edits. So I appreciate her hard work, and I'm also sorry that she couldn't be here with me due to a schedule conflict. So please allow me to represent on behalf of her to introduce our work. And you can see our poster's title is Multiple Parties Join Hands to Help Chinese CLL Patients Achieve Better Treatment Outcomes and Quality of Life. And in order to let you see the content more clearly, I divided into part. Our group was founded in 2011. It's the only nationwide lymphoma and SLL patient organization in China. The registered users have exceeded 115,000, including 2,500 CLL, SSL patients and caregivers. And the numbers of new users exceeds 20,000 every year. And when we start our work, we try to find key pain points for our CLL patients. Like we still have cervical gap. It is lower than US, and due to the following reasons, like limited novel drug access, treatment tolerance, and drug resistance issues, lacking of effective therapies for high-risk patients, and high out-of-pocket costs. In response to the above pain points and unmet needs, we carry out popular science, patient service, and advocacy activities through multiple channels and platforms, as well as through multiple party cooperation to help patients achieve better treatment outcome and quality of life. And actually, in China, CLL is really rare and low in occurrence. Every year, there's around 7,500 cases. And we provide contents while multiple channel online and offline platforms like these tools you can see that is all very popular in China. And we also provide multi-dimension education and service like our forum. We provide disease knowledge part and indolent lymphoma outpatient map, so they can easy to find physicians who is focused on CLL. And also we have forum for patients to share their experiences. And also we assist patients in clinical trials enrollment. When patients with a refractory and relapse, we quickly connect with medical resources. And we provide offline patient education activities like expert lecture and patient sharing at the special session, and treat parties exchange meeting among doctors, patients, and enterprises focusing on long-term protection. And we have online live streaming course. We provide a series of online education lectures about diagnosis, treatment, and follow-up, and online answers to patients' questions. And we also join our CLL AN's World CLL Awareness Day. And this year's, because we submitted a poster earlier, so it didn't show this year's activity. And so the conclusion is the prevalence of CLL in China will continue to rise when the population aging and patients and their families' pursuit of cure and quality of life is also increasing. Patient organizations have broken through their traditional role of popular science and service, becoming a key bridge connecting medical resources, policies, and patients. Our group will further build medical research patient government collaborative platform, accelerate the clinical transformation of innovative therapies, and improve drug accessibility. And we have a vision that to navigate patient journey, accelerate healing pathways. And that is our poster. At the end, I also want to use this opportunity to show appreciate to CLLAN. First, I want to thank our committee for having me here and giving our group the chance to show our work and learn from all of you. Really appreciate it. And I also want to thank all of our speakers. Your generous sharing let me learn a lot. And all in all, I hope to bring this warm feeling and tools and information back to China and extend it to more CLL patients. I believe that with our collaboration will illuminate the path forward for those battling CLL and their families. That's all. Thank you.
Thanks very much. Sorry?
Good.
Okay, so I had to do the difficult thing of maybe telling our speakers to speed up because we're running tight on time. But I think it's really important that we hear what they have to say. So if you can just bear with us and that we can have that session then on innovation at the end. But we do need to listen to what's happening in the region. So I'd like to welcome Ismail Mwaruka, I hope I'm pronouncing that right, and he is the founder of the Blood Cancer Foundation of Tanzania, which has raised awareness of lymphoma and blood cancers across the country and built strong community events. I'm really looking forward to hearing from you. Thanks.
Hello, guys. Just to set it straight, I'm not the founder. I'm a patient advocate. Okay. Thank you. My name is Ismail Mwaruka, and I'm a media specialist and a patient advocate at the Blood Cancer Foundation of Tanzania. This is a small patient-led advocacy group that whose main mission is focused on supporting patients, raising awareness on blood cancers, and improving the overall quality of life of blood cancer patients. Today, I'm honored to share with you how a simple low-cost video helped us raise awareness about blood cancers during the Tanzania's largest festival, trade fair, and why this approach could work in many other countries. In Tanzania, as in many low middle-income countries, people lack knowledge about blood cancers, and that, coupled with long-distance travels, negative cultural beliefs, and weak psychological support, leads to late diagnosis and preventable deaths. And stigma keeps people silent. But this isn't just Tanzania's problem or issue. It is a global problem affecting underserved communities everywhere. In July 2024, during the Sabasaba Trade Fair, we saw an opportunity to reach thousands of people from all walks of life, away from hospitals and clinics. We asked, how do we bring them to our tent to learn about blood cancers? Our answer was a short, heartfelt advocacy video. As Yana insisted yesterday through the breakout session on the importance of having bite-sized, topic-focused videos and not long, boring ones that the patient or the community wouldn't understand well. It invited people to visit our tent, hear survivor stories, and learn about early detection. We shared it on social media, like Instagram and Facebook, reaching people where they already are. The response was powerful. Across 2 weeks, we had 511 people visiting our tent, with over 100 on the busiest day. These visitors didn't just take flyers or leaflets. They asked questions, listened to survivors, and many pledged to get screened afterwards. One visitor told me, "I never thought cancer could be caught early. Now I'll talk to my family about screening." Of course, awareness is just the first step. Why is it? Okay. Of course, awareness is just the first step. When people learn, they demand screening. When survivors speak, stigma falls. Together, these grassroots sparks can grow into stronger public demand and eventually influence health policy. This approach isn't limited to Tanzania. In another country, it could be a market, a church, or even a sports event. The tool, video storytelling, is universal. It cuts across language, literacy, and stigma. Okay. Of course, we face challenges. Our reach was limited to those people who are at the fair or online only. And with very few resources, we had to rely on volunteers and personal devices. And stigma and misconceptions about cancer still run deep in the families and the relatives, this requires long-term work. These challenges don't discourage us, but they remind us why support and collaboration matters. And this reminds me of an important takeaway from yesterday's small budget, strong impact breakout session, which is to think outside the box and come up with creative methods, investing more in building trust and maintaining partnerships. Fortunately enough, I have gained insight from my colleagues, Ms. Leila and Dr. Becky, that I'll kindly share with you today. One is engaging more in patient public involvement programs to help raise awareness in our community. An example is the upcoming walkathon and fundraising event in the 16th of this month that will begin in the hematology clinic at the Serum of South Africa, the clinic that Dr. Anashu yesterday mentioned, all the way to the Ocean Road Cancer Institute. Another one is the twinning idea. It's a very interesting venture indeed. Dr. Becky elaborated extensively on this one yesterday, but in a nutshell, it's more of a mentorship between patient advocate networks from high-income countries and those in the low-middle-income countries. And this mentorship program is finite with measurable goals. And I say finite because the twinning period is meant to give a boost in terms of knowledge, of sharing knowledge and resources to the advocate network in the low-middle income country. But in a period of time, say like 2 years, something measurable, right? This will allow the advocacy network from the high-income country to then move their focus after that period to another advocacy network in another low-middle income country which has needs. My take-home lessons are simple. Passion counts more than budget. Public spaces can be advocacy spaces, and survivor voices build trust and break stigma. In closing, I want to leave you with this. Even a 1-minute video can change lives, but with your support, through sharing knowledge, partnerships, and solidarity, we could scale this impact beyond Tanzania. I extend my deepest gratitude to all our supporters, partners, and the resilient individuals still fighting against blood cancers every day. If you would like to get involved, you could do that by scanning this QR code that will lead you to our Linktree account, where you could follow our social media channels like Instagram, Facebook, and you could reach out through email. From Tanzania, thank you.
Okay, so I'd like to invite Pasusant up. Pasusant is an advocate from Thailand, representing the patient voice in Asia and advancing equitable access to diagnostic and treatments. Thanks.
Hello, everyone. Due to time constraint, I will try my best so that you can have a beautiful and breakfast and lunch now. Okay? Okay.
More sessions.
Okay.
Don't mention lunch. We're keeping them in
Okay. Sorry about that. Okay. My name is Pasusant Wattanaboony. I'm truly honored to be here with you. I stand before you not only just as a volunteer or patient advocate, but I'm a survivor, 27 years survivor of the chronic myeloid leukemia. I was first diagnosed. The future looks very uncertain. At that time, the treatment options were very limited. I remember the fear, the confusion, the many unanswered questions. Surviving this long, it was something I cannot imagine. Okay. But through the progress of the science, the dedication of the doctors, and the support I received, I am still here today. And over the years, I have learned that knowledge, connection, and support can make all the difference and impact in a patient journey. This personal experience is what led me to an advocacy. I began by founding MPN Patient Advocacy Group Thailand. Later, I expand our work to cover all types of leukemia, definitely CLL. My mission has always been simple, very simple. No patient should feel alone. Every patient should have access to clear information, support, and hope. With that in mind, let me share with you our project. Strength in knowledge, hope in action, empowering patient and family to knowledge, connection, and support. In Thailand, many leukemia patients and their family face serious challenges. Me too. Reliable information in Thai is limited. Much of the material is either not translated to technical and not adapted to our Thai culture. As a result, patients, especially for those living in the rural or underserved area, often feel lost, isolated. They don't know what question to ask, what their lives are, and where to find emotional support. This is the gap we want to fill. So what we did to address these problems, we created Leukemia Navigator program in Thailand. This program combines both digital tools and community outreach. Here are the main steps that we took. Leukemia Navigator Kit. We developed easy-to-read resources in Thai. These are available as printed and PDF file, so patients and caregivers can access anytime. We also have Facebook page, which is the one of the most popular social media in Thailand. We launched the CLL Patient Advocacy Thailand page to share updates, resources, and patient story. Websites. Our website, worldwidewebthaileukemia.com, became a 24-hour, 7-day hub for the trust information. Direct support. We use the Line app and phone calls to connect with patients who reach out for for personal health. Newsletter. We start a CLL Thailand newsletter to share health tips, updates, to build a stronger sense of community. Global resources, this one is very important for me, for my organization. Even I'm a very small organization. We adapt all the material from Active Leukemia Advocate Network and definitely CLL Advocate Network, translating them into Thai so patients could benefit from the international knowledge into their own language. So next, hospital partnership is also very important. We work with local doctors and some hospitals to distribute the toolkit directly to patients and caregivers. So what did we achieve so far? Definitely, our intention was successfully. We have already created the comprehensive leukemia navigator toolkit in Thai, covering the disease, treatment journey, self-care, patient life, and access to service. But it's still at a starting point, okay? The material was designed to be clear, relevant to our, and easy to use to our patient. So by combining online platform with the direct communication, we build a stronger connection with patients. Our website, Facebook page, newsletters increase visibility, trust, and engagement with the patient community. The impact has been clear. Patients now have trust information in their own language in Thai. Okay, so we are reaching people in both city and rural area, and families feel less isolated and more supported in their journey. And most importantly, we now have a sustainable model that can grow and continue to serve our future patients. Conclusion. In summary, this project shows that when patients are empowered with knowledge, support, and they gain hope and confidence, it has helped us build a stronger leukemia community in Thailand, one that connects patients, caregiver, and healthcare professionals. Last but not least, but most important, gratitude. This work could not have been possible without the incredible support of the global community. I want to give my heartfelt thanks to CLL Advocate Network, Alan Acute Leukemia Advocate Network, CML Advocate Network, which I'm the CML patient, and definitely MPN Advocate Network for their guidance, encouragement, and resources. So someone who has lived with leukemia for 27 years now, I know firsthand the power of hope. And I believe that together, to knowledge, connection, and support, what continue to make a difference. Not only leukemia patient or CLL patient in Thailand, but patient everywhere. Thank you for your kind attention.